We're having a few technical difficulties. Okay. Oh, friends. And there it comes, and it's delayed. Well, sometimes it happens that you have technical difficulties and you just have to roll with it. You can see behind me that we are having a live feed right now into Caesar's Palace, where we're coming to you live up on stage from the Augustus Room. So, to all of you that are joining us from around the world, I see a few of you have been waiting patiently, and we appreciate that. To our doctors, our dentists, our researchers, our experts from around the world who are attending the Breathing Wellness Conference in Las Vegas, it's an honor to be with you tonight as we prepare for this 9th live broadcast with a live and a virtual audience. So, to all of you who are taking time out of your busy schedules, we appreciate you. Tonight is another important conversation as we bring together the pieces of the puzzle in the diagnosis and treatment of sleep apnea. I will be joined momentarily by two leading experts in their field, and the focus tonight is on telemedicine. As I mentioned, we are coming to you live from Caesar's Palace in Las Vegas. So, as we focus on telemedicine, one of the biggest challenges for patients is when they discover they have a sleep disorder. It's accessing a specialist for diagnosis and counseling for obstructive sleep apnea. The hope in medicine is for diagnosis and treatment within 2 weeks. The reality is, patients can wait up to 3 months in order to see a specialist. Well, tonight we will talk how we can help the breathing wellness movement by becoming a part of telemedicine dentistry for obstructive sleep apnea. As many of you are logging on to the broadcast tonight and watching from wherever you are joining us, please go ahead and introduce yourself. We love to continue the conversation online, and it does help us to know who is with us and where you're watching from. And many times our experts know you and want to connect with you, and we welcome your questions throughout the duration of this podcast. Dr. Sahil Chopra will be joining us over the next hour. He's a sleep specialist and intensive care doctor from California, along with Dr. Tammarie Heit, who is a general dentist from Canada. And then we'll explain how medicine and dentistry can work together to improve access for diagnosis and treatment of obstructive sleep apnea. They will demonstrate the use of telemedicine platforms in 2 countries to simplify and to streamline healthcare. So, as we get this broadcast underway, I see there are a few people that are joining in. Dr. Jane says hello from Toronto. It's so great that you are with us again tonight. We wish you were with us in Las Vegas, but do keep questions coming, and we love your support throughout the next hour. My name, everyone, is Carrie Dahl. I was a longtime television medical reporter and 6 o'clock news anchor turned public speaking coach and podcast host, and I am honored to serve as your host for tonight's virtual event. We appreciate the time that all of you are taking out of your lives to join in and participate in tonight's broadcast, and of course, to learn more about the incredible work that is involved in diagnosing and reversing sleep apnea. As I mentioned, we want this next hour to be as informative and as interactive as possible. So please join in the conversation. You do not need to wait until the end of the broadcast to ask questions. We welcome your questions as they come in. Just go ahead and give StreamYard permission to use your name so that I can see who we are talking to. So the format for the next 60 minutes will look something like this. I will begin by interviewing Edmonton dentist, Dr. Tammarie Heit, who has successfully reversed sleep apnea in a number of her patients. Then Dr. Sahil Chopra will follow Dr. Heit's presentation. Then I'm going to bring the two of them together to collaborate so you can ask questions of them. And of course, all of you who are watching from home can ask your questions virtually. We will wrap this presentation it will be 7:30 Pacific Standard Time. I also want you to keep in mind that if you do have to leave early, this broadcast, will live on the scienceofsleepapnea.com. So if you want to watch it again, all you have to do is head to that website. So with that, let's begin, shall we? After a few technical difficulties, we're here, we're ready to go. And I would like to begin by welcoming Dr. Tammarie Heit, who, as I mentioned, is a driving force behind these broadcasts and so determined and passionate about fostering more collaboration between doctors and dentists in diagnosing sleep apnea and ultimately saving lives. Dr. Heit has spent the last 25 years working in general and craniofacial dentistry and lecturing worldwide for 10 years to dentists, to orthodontists, and to medical doctors on her published research and findings. Dr. Heit has successfully reversed sleep apnea, which she will talk about, and she is on a relentless mission for dentists and doctors to work together to collaborate on the diagnosis and treatment of sleep apnea. And without further ado, I bring you Dr. Tammarie Heit joining us live from Las Vegas. See you.
Hello, how are you? I hope you can hear me.
I can hear you. It's amazing all the hoops you have to jump through to get a broadcast like this working, but we did it. And as you can see, we are live from Caesar's Palace here at Las Vegas. So this is episode number 9, but we have completed 8 episodes to date. Tell me, Dr. Heit, what is unique about this one?
Well, this one is the very first one where we have not only our virtual audience, but a live audience. So it's very exciting. It's the first time we've done it. And we might have a few growing pains, but, life wouldn't be fun without that.
That's right. We have to be able to put our, it takes a village sometimes. And up here on the stage, we had some really incredible people helping us bring this to life. So here we are and ready to dig in. And I want to ask you, in the past episodes, they show patients and your work collaboratively with medical doctors. So how do you visualize and implement this medical dental collaboration in your general dentistry practice? Because this is so important to you. This is at the heart of everything that you're trying to achieve here.
Well, mostly in my dental practice, I'm just consulting medical doctors and they're consulting me. And just the following up of treatment and things like that will perpetuate a relationship that they'll want to be part of. So we have to kind of think like medical doctors a little bit and write a letter and write another letter that's a follow-up letter, and they'll want to know how you got the results, and that's where it starts.
So this is what we would call some pretty incredible results. So I'll let you take it from here as you take a look at your slides.
So if you just, go back to the first slide, if you want to know how I began, it was my patients that came to me with craniofacial pain, and I didn't know we were doing anything with the airway at that time, but I had an idea that I could grow the upper jaw, and I got that from my own colleague, and I wondered if it would help her pain. And so I asked her if she would try that, and she said she would, and her pain was actually gone within 3 months. But she stayed in treatment for 18 months. And so this is the result. And if you look at her face, her upper jawbone grew, and it grew so much that now her teeth could fit in there. And then her double chin went away, just because her bottom jaw was then able to come forward. And her pain went away, and this wasn't the only patient this happened to. I started treating these patients with OAT therapy, which is biomimetic oral appliance therapy, and being able to graph all the results, and they were pretty much going away. The pain was going away.
So in adults, what kind of changes were you seeing?
What we did is we took a bunch of adults in a snapshot in time, and we sort of try to figure out what actually happened. And what happened was we grew the upper jawbone, which I was taught that couldn't be grown in adults, and the average age was 38 years old. So I've treated 60, 70, 80-year-olds, and some of those people were pretty happy to have straight teeth for the first time in their life. But also they could breathe better through their nose, because when that bone grows, the whole bone grows, and the hole in the bone grows, which is the nasal airway. So not only is there room for the teeth, but the bottom jaw can then come forward and open up the obstructed airway in the neck. So we're in fact impacting two areas in the upper airway. And then we had the idea to start doing sleep studies. So we started to do sleep studies before and after taking care of these patients. So here's a patient who had quadruple severe sleep apnea. And she didn't, her weight didn't change, but in 9 months, we brought her down from 70, like initially we took out her tonsils, but after now, 6 or 7 months later, she still had an age high of 70, and I treated her craniofacial region. And so if you think about the teeth and the jaws like a garage and the tongue is like a car, before treatment, she had a deep overbite, and so that was a garage with a 5-foot ceiling. And after treatment, she has a 10-foot ceiling in her garage, a lot more room for that tongue. And then from the front, she had a 1-car garage, and now she has a 2-car garage. So it was very profound to bring down this sleep apnea down to 1, which is a clinical reversal of sleep apnea when it was quadruple severe. So for the doctors that took sleep studies last night here at the Breathing Wellness Conference and probably fainted when they saw they had severe sleep apnea, there's hope for you to actually reverse this. So you should treat yourself. And you can treat yourself. So if we go on to the next view, if you go on to the next slide, you'll see that this wasn't the only patient I did this in, and the slides kind of transferred funny, but the dark blue is very severe sleep apnea, or many people with severe sleep apnea for treatment. And then if you look at the stack of columns after treatment, you'll see that most of those have completely reversed. And in the severe category, it shrunk down quite a bit. But according to medicine, if you take someone's AI from 97 and make it 32, that could profoundly impact their life, not just the longevity of their life, but also the quality of their life. So another, this is another patient that basically, he came to me for other reasons. Like, how do these patients find you? Well, once you fix their craniofacial pain and their sleep apnea, they just refer each other to your clinic. So he had really severe jaw joint pain. And when we did a tomogram, we could see that half of his condyle was gone in his TM joint. And we treated him with this spoke therapy, and we can see that his maxilla grew, and you can see in the soft tissue, the functional space has increased in size and symmetry. And then if you look at his tomograms, this is like just barely over a year, I think. His pain was gone in the jaw joint, but he started to get regeneration in that joint. And, the condyles can remodel through life. So my job as a dentist is to screen for sleep apnea and diagnose any craniofacial issues. And one of those diagnostic statements is maxillary deficiency. Another one is mandibular discrepancy of the cranial base and possible sleep apnea. And if they have possible sleep apnea, I need to send them to a sleep specialist. And sleep specialists get these patients in the clinic too. And if they understand the craniofacial presentation of somebody who had sleep apnea, then they'll realize that dentists can help. So, that's how you start working with these people to make an unhealthy person healthy, is by collaborating with these medical doctors. So There's Dr. Chopra there. Dr. Manita Whitman's is on children. This can be done in children and adults. And basically, having communication with a letter is the best thing. These are level 1 sleep studies. There's other options now. You can, do take-home studies with, belts around the chest and things like that, or you can get a ring. But the technology now is just a ring on the finger that connects to the phone, and, you can plug it in on the computer, charge it up, and it's really inexpensive. So you can pass it around the family and have everybody wear it, and you can actually read the results the very next day. That's what they're doing here at the Breathing Wellness Conference.
Dr. Heit, how can all of this be used in telemedicine?
Well, I mean, for the technology to be so easy like that and accessible to everybody, like just think of being a doctor coming to this conference and getting one of these rings, taking it home to your hotel room, getting the result read the next day. You could send that over the internet to a medical doctor, and I'm so excited for Dr. Chopra to tell us about telemedicine, because that person needs a diagnosis and they need counseling from a specialist, and that person needs to know how serious the sleep apnea is. And one of the options can be this boat therapy we're doing that can actually potentially reverse the sleep apnea. And what I'm hoping is that the doctors attending this conference start treating themselves and their families. A lot of them brought their families here, and the results are kind of shocking. So dentists have been doing this for decades. I mean, we've been making maxillas bigger and even increases in nasal airway, but we haven't been measuring sleep apnea until more recently. And with this technology, it's going to make it so much easier for people to get this diagnosis and improve their health. Because right now in dentistry, there's 200 appliances that just basically hold your jaw forward or hold your tongue out of your mouth. And, people, if you don't wear it, it doesn't work. It doesn't reverse the sleep apnea like the boat therapy does. And so dentists will glue things to people's teeth, and that's a different way of doing it. It's not boat therapy, it's inflammatory, and it just doesn't work the same way. So here's a fella in his 50s, and he had ortho relapse 3 times. And so this time we're going to grow his jaw. And so here's what one of these appliances looks like. There's his jaw in the middle of treatment. You can even see spaces developing where his teeth were extracted the first time he had ortho, because his jaw was so small. And he's feeling better and looking better. So I'm very, very excited to hear what Dr. Chopra has to say about telemedicine, because I would love to be able to forward one of these sleep studies to him and get the patient a diagnosis and treatment options.
I'm looking forward to the conversation between you and him and the collaboration that can result, because once reports are back through telemedicine, things get a lot easier. And I'm sure that he's going to talk about that as well. It could be a massive game changer in the treatment of sleep apnea. Dr. Heit, thank you so much for muscling through some of the audio challenges here. I know there's a delay as we're in the room here at Caesar's Palace, but you rolled with it, and there was some valuable information that came out because of it. So I'm going to let you catch your breath in the virtual green room, and we'll talk to you momentarily. Oh, this opens up so many possibilities when we start to talk about telemedicine. So it's now my pleasure to welcome Dr. Sahil Chopra to the broadcast. Dr. Chopra was born in India and brought up in California. He went to medical school in India and then returned to the United States, doing an internal medicine residency at UCLA and then working as an internal medical doctor for 3 years, at Loma Linda University. That was followed by a 3-year specialization in pulmonary and critical care medicine at Loma Linda. It was during that time that he became interested in sleep medicine and did his sleep medicine fellowship at Harvard Medical School. He is a triple board certified in internal medicine, pulmonary medicine, and critical care medicine, and will take his sleep medicine boards this year. He is currently working as a pulmonary and intensive care medicine doctor, as well as a full-time chief sleep giver, a CEO at Empower Sleep, where their mission is to make sleep care simple, widely accessible, and personalized. He's driven to solve complex problems and considers himself, I love this term, a doctorpreneur. Without further ado, let us welcome Dr. Sahil Chopra to the broadcast. It is so nice to have you with us.
Can you hear me okay?
Now I can. Yeah, your audio is working great.
Perfect. Thank you. So exciting to be in front of this live audience and this live virtual audience as well. Thanks for having me. Really
There's a
excited
lot
to have
going
this
on here
conversation
technically.
Yeah.
So, Dr. Chopra, let's begin by talking about virtual ecosystems that are born to battle what you call the silent epidemic of sleep apnea, and so many other doctors call it that silent epidemic as well. Why do you say that, and explain that difference?
Well, when you talk about virtual, like you and I are meeting virtually. So if we can have a conversation virtually, then that begs the question, why can't I have a conversation with a patient virtually? And if I can have that, then that could mean that I can have a conversation with another specialist virtually.
Mm-hmm.
So if that's the case, and if that's true, then maybe we can all collaborate on a virtual platform to solve this complex problem. And what I mean by like having a virtual ecosystem that is born to solve this complex problem is exactly that.
So explain more and dig into, how does telemedicine work for sleep apnea?
So telemedicine can work for anything. So like in sleep apnea, I think it's very unique, and it can be customized for this because sleep care in the United States is very clunky. So for example, like one can go to Best Buy and buy a sleep recorder, but it won't really talk about their sleep healthcare. Sleep healthcare is like not very accessible. So in the traditional model, one would first have to go like to their doctor. It could be a dentist, it could be a PCP, a pediatrician, or a sleep specialist. They at that time would order a home sleep study or a laboratory sleep study, and after that, somebody would have to review the results and go over that diagnosis with the patient. And usually, this whole process would take like weeks, but most likely months,
Okay.
before the patient would actually get diagnosed and started on therapy. And you can see in this whole process that the patient had to go to a doctor's office. They may or may not have had to sleep in a sleep lab. They would have had to go back to the doctor's office for reviewing the results, going over the different treatment options. And it's just, we can save a lot of time both for the patients as well as for providers if we do all of this through some sort of a virtual medium.
So what happens then if we all decide to work together and collaborate? And when I say we, I mean your medical community.
Oh yeah, definitely. So for example, like what we're doing is we would establish a doctor-patient relationship with the patient online. We then would ship them whatever is the most appropriate home sleep test to ask the clinical question that we have. And then we can again virtually review the results with the patient and come up with a customized treatment plan to guide them. And the exciting thing is like we can do this in a very short period of time. We can do this in under like a couple of weeks. And after that, because everybody is a part of this virtual ecosystem, we can refer them either to a brick and mortar sleep doctor if needed. It could be an ENT specialist if needed. It could be a dentist if needed for an oral appliance. But the exciting thing is that you have this virtual community who is all sort of trying to solve this complex problem.
So I'm just curious today, what kind of feedback have you had from patients who you've done this approach with?
Oh, it's been super positive. And again, I know I would have a bias about this, but we have been able to solve at least 95% of sleep disorder problems all through a virtual platform. And we've been able to get patients from landing on our website to having a CPAP delivered to their door in under 2 weeks, 2.5 weeks, or referred to a dentist with a treatment plan, and like a well packaged, uh, treatment plan of this is what should be done next for this patient.
What are patients telling you about this approach?
They're really enjoying it in the sense like that the fact that they can do all of this from their home, and they can then go directly to a provider if they need it, or if they needed some specialized therapy like a CPAP device, we can directly ship it to their home. So it just saves them a significant amount of time. Many times these patients are at work or at a lunch break, or it just becomes a really convenient solution for them.
So, Dr. Chopra, how does someone get involved in your community? How can they join it and join the network? Walk us through what that process looks like.
So I'll share a QR code at the end if you would like to join. But this is just sort of sharing that the American Academy of Sleep Medicine, which is sort of the authority that kind of guides us on what to do, has very clearly stated that the practice of telemedicine should aim to promote a care model in which sleep specialists, patients, primary care providers, and other members of the healthcare system like dentists, ENT, all aiding to improve the value of healthcare delivery in a coordinated fashion. So basically, if we can all rally everyone together in a virtual ecosystem, we can provide this care.
And that really is the key, isn't it? Is rallying people and getting them used to a new approach. Because I'm going to bring this into the conversation. We look at how our life has changed in the last almost 2 years post-COVID. Whoever would have thought that major board meetings and all types of business meetings would be taking place online? But it's opened up a new way of thinking and doing things. And the same can be applied with your approach to telemedicine. Can you comment on that from your experience after using this?
Oh, for sure. And I like, from the physician standpoint, physicians have been loving it because for them it's sort of a plug and play software, which is an EHR, where patients are scheduled on their calendar and they can see patients at their own convenience. And the most exciting thing is they can do this from anywhere they want. If like I did this solving a problem for myself, that because I wanted to live out of a camper van and have that kind of a lifestyle that I can basically take my laptop and do whatever wherever I wanted to. And I think we can actually create that for other sleep physicians and other maybe ENT and other primary care physicians who want to help us to build this virtual ecosystem where they can work from home at their convenience and still have a good quality of life, reduce burnout, and so on.
On that note, I just want to circle back to your introduction where you said like you were driven to solve complex problems. Tell us more about your why behind this, because I know you are very passionate about it.
I think there's a couple of reasons, but like one of the big things that sort of got me interested in this space was, as a pulmonary and critical care fellow, we see a lot of patients who have sleep apnea in pulmonary clinic. And what would happen, not all the time, but it happened enough times that it sort of got me thinking, is patients would come for a sleep evaluation. We would order a home sleep test. It wouldn't get done for like 6 months. They would come back after getting the sleep test completed, and maybe a year has gone by. And then Medicare says that the sleep study is a year old and you have to do it again. And it's just such a clunky system that if we can make this more efficient, potentially through telemedicine, we can save the patients a lot of time. So that was like one thing. And then I think the other thing that got me interested in sleep in general was I personally was very sleep deprived. And in fellowship, like as an intensive care pulmonary critical care fellow, it's not unusual to have 70 to 80-hour work weeks. And around that same time, we had a young family. So it was just, if I felt like somewhat of a mental wreck. And if I was not functioning well, but I had a problem that was going to get better after 3 years, people who have a obstructive sleep apnea or insomnia, that problem is not going to get better if nobody solves it. So I just sort of related very well with patients who had a sleep issue, because I personally had chronic sleep deprivation for a while. And so I think like a mix of that and like being a little bit on the tech savvy side, I just thought it was an interesting problem to solve.
So that brings you to the sleep medicine care under one road, as we're looking at right now.
Right, correct. And this is just a proposed model, again, from the American Academy of Sleep Medicine. I'm not a researcher expert by any means, so we follow what the Academy says, and these are proposed models by people who know what they're doing. So if we, it's a little clunky slide, but you can see that the patient in the middle of on the left side, they go get a sleep test done. Somebody reviews a sleep test, and then based off of that review, you can refer the patient to either a dentist or an ENT, or you can get them on any kind of personalized therapy. And if we can do this in a brick and mortar place, we can potentially replicate this on a virtual medium. And the whole idea is that we can be patient centric and potentially even have better outcomes.
Harmony Myofunctional Therapy writes, this is such a wonderful approach. This will help improve access to care. Our patients will truly benefit.
Yeah, thank you, Harmony. I appreciate the kind words.
Dr. Chopra, we appreciate your expertise in this area, but before I let you go, you have to talk about this QR code.
Oh, yeah. So if you would love to join our community of virtual specialists who want to participate in providing sleep care, scan the code. It'll take you to our join list. We need an army of physicians who want to solve this problem and want to create an amazing lifestyle for patients as well as for themselves to be able to work from just a laptop. So if you're interested in that kind of stuff, please, join us, and we would love to have you on board.
To everybody watching, go join Empower Sleep. This can make a massive change in the journey to find a cure for sleep apnea, but more importantly, for treatment, to increase access to amazing doctors like you. Dr. Sahil Chopra, we appreciate your perspective. And let's bring Dr. Heit into this conversation, because I know that she has questions for you. Dr. Heit, what do you think about that approach?
Oh, I absolutely love it. I personally feel like the dental device I do, the bow therapy that I do, can also be done by home. So telemedicine and teledentistry, I think, is like chocolate and peanut butter. So I'm curious what you think about all the dental appliances out there and this new one. Do you see a difference?
You mean like the boat therapy versus the other ones? Yeah, I think
Yes.
it's really interesting. It's like a very novel way of solving an anatomical problem, and one does not have to exclusively be on that therapy. The good thing about having multiple specialists on board and in a community is that you can have somebody who is on this sort of biomimetic oral appliance therapy, and at the same time they're still on CPAP, or they're on another device, and you provide that safety net with other immediate working therapies, while the boat therapy does what it's supposed to do over time. So I think it sounds very promising, and I'm very curious to learn more about it.
Yes, I love
that's the wrong word, but like to see what happens over time.
Yes, I'm excited about that too. I do encourage my patients to wear the CPAP, because the way it works is it turns on stem cells, and stem cells need oxygen. So if they have CPAP, I actually would estimate that their therapy might go faster. But, we're in the business of trying to prove that and evaluate that, and also long-term results. I feel like the teeth are going to support the new craniofacial anatomy, and we need our orthodontists to really line up the white things and dial in that occlusion to support the new anatomy of the jaws.
Right, right. I mean, you're the dentist, so I won't comment on any of that stuff.
Dr. Chopra, I am curious how other doctors are reacting to your approach using telemedicine, because sometimes the word itself, when you know that you're using technology in healthcare, can be a little bit scary and intimidating. What kind of reaction are you getting from health experts from this approach?
Had COVID not struck, I think there would have been a lot more skepticism, but COVID sort of forced us to do this and try it. And when I was in fellowship, we had very good outcomes taking care of patients through a telemedicine model, where we would have a conversation with the patient over the phone. The sleep lab would ship them the sleep testing devices. We would review the tests over the phone, and then we would even ship them the CPAP device directly to their door. And if they had any complex issues, then we would do repeat home sleep testing for them, and then sort of titrate that device to where they want it to be. So I think the evidence is both objective as well as anecdotal is relatively strong that we can do a good job for patients. And I think the exciting thing for providers is that they can do this from home. And I think most people who are like coming out of fellowship now, they want to have a good quality of life, because burnout in the medical community is a thing. And if you can create the best possible online sleep care based career for physicians, then I think you're doing something pretty amazing.
Dr. Heit, from your perspective, is this the next step in the journey, an important step in the diagnosis and treatment of sleep apnea?
Absolutely. And I feel like a lot of patients and people in general are going to the University of Google, and it scares me, frankly. People are just kind of looking up their symptoms and diagnosing themselves and trying treatments, and then they just get all messed up. Or if a doctor gives them a diagnosis, they run to Google and they try a bunch of stuff that hasn't been proven, hasn't been tested by our universities, and the ways that we know work and are right. And I'm hoping that we take our brains, our medical doctors with all their experience and training, and we give patients an option to do something more sensible and contact a real doctor.
Yeah.
Dr. Chopra, go ahead. You were nodding your head in agreement. So.
Oh yeah, totally. And I was just thinking, people use their data from the Fitbit to make their own diagnosis. And if you can make it just as simple for them to get an FDA approved home sleep test, that's so much better. And to connect them to a sleep physician who can review those results with them, it can either put their anxiety to peace about sleep, or it can guide them in the right direction of what would be the next step to solve the problem. So I think these wearables they're an interesting tool to help patients identify a problem, but then instead of having to go to Google to self-diagnose themselves, they can just get a home sleep test, see a doctor, and get all that done in the comfort of their home. So that's definitely true.
And let's be honest, we talk about sleep and the importance of it. Both of you, have dedicated so much of your career to working with it. And tomorrow here at the Airway Summit, we're going to be hearing from the amazing Dr. Matthew Walker. And sleep is the foundation of our health. So speak to that, why this is so vitally important.
Tammarie, I'll let you go first.
Yeah, I just love Matt Walker's book. It's called Why We Sleep, and he's just he's made it very easy to understand. And really, I think a lot of people could just do quite a bit to their own selves, even if they don't have sleep apnea, to improve their health from some of the things that he says in there. And it also helps medical doctors and dentists collaborate, because everybody's reading it and challenging it even, which is stimulating conversation, and it's an absolute phenomenal way and contribution to our world. So I would recommend everybody read that. I ask my patients, I give it to my patients as a tool. It's not just medical doctors and dentists, it's myofunctional therapists and chiropractors and other, just all healthcare providers to help improve people's health and preventative medicine, to live a better quality and a longer life.
Mm-hmm. Go ahead, Dr. Chopra, talking about the importance of sleep and why it's the foundation of our health, really.
Yeah, no, I totally echo what you're saying, Tammarie, in terms of the importance of, it's basically sort of like so Matthew has this like quote that, and I'll paraphrase it, is that sleep is the foundation on which the pillars of health sit. And so it's an interesting way of thinking about it, because previously I used to think of it as it's a pillar of health, but rather it's more of a foundation on which the pillars of health sit. So it just sort of emphasizes how important that is. And if, there's a lot of evidence that says if sleep is bad, either because of insomnia, sleep apnea, restless legs, and so on, overall cardiovascular outcomes are significantly worse, specifically being like mortality. And in some people who sleep too long because of a disease or sleep too less because of a disease, mortality in these patients is higher. So there's enough evidence that sleep needs to be fixed if there is a problem with it, and it will hopefully improve longevity over time.
And I loved how he painted a picture of the anatomy and the physiology of sleep. And I think that way about the craniofacial area. And I feel like this is a piece of the puzzle that's ready to be connected to this piece, which then goes all the way down.
Closing thoughts from both of you tonight on the power of collaboration and using telemedicine in the diagnosis and treatment of sleep apnea. Sahil, you want to go first on that one?
I would just again emphasize that sleep is foundational to health, and that if your loved one has a sleep problem and they need help, you can definitely look for a sleep physician in your community to help solve that problem, whether a children or an adult or a grandparent. And if not, then maybe even looking for somebody online would be a potential solution, because sleep is one of those things that, and I'm saying this from like patient experience, is that people don't know how bad they felt until they actually got a good night's rest again. And it's one of those chronic diseases that over a decade, 2 decades, people get used to having a sleep problem.
Mm-hmm.
But when you start fixing it, people start feeling so much better that they completely forgot that this was impacting their life in such a negative way. So I would just encourage you to get screened, see somebody, and seek for help if your sleep is not good or perfect or where you want it to be, because there's help out there.
And that QR code that you gave us earlier, they can find that when this is put onto the scienceofsleepapnea.com that Dr. Chopra was talking about. So that's where you can find his QR code and more information, how you can sign up with that. Tammarie, your closing thoughts tonight as we wrap up episode number 9?
Well, I have to give a big shout out to Vivos Therapeutics for putting on this just absolutely amazing breathing wellness conference here in Las Vegas. These huge rooms full of intelligent people and medical doctors and dentists coming together in collaboration is what we need. And the medical consortium they've developed in this company, they're going to lead the world in this. And all dentists and medical doctors should become part of this beautiful conference and this excellent company, so that they can learn not only how to collaborate with each other, but some of the new things that are out there that they would love to you'll find a benefit for yourself and for your patients. So I'm really grateful to the platform of Vivos.
To both of you tonight, thank you for your patience as we muscled through technical problems, and for the expertise and the perspective that you brought to this issue, and of course for the impact that you're having on countless lives and any patients that are able to be treated by you. Dr. Chopra, we so appreciate your time and your perspective and the advances that you are making through your telemedicine approach. Thanks for being with us tonight.
Oh, thank you so much for having me. Bye-bye.
Well, Dr. Heit, that brings to a close episode number 9, live from Caesar's Palace here, muscling through a few technical issues, but we had a brilliant conversation, explored the issue of telemedicine, exciting new frontier that opens up all sorts of possibilities. And of course, I want to emphasize that for anyone who was not able to watch this broadcast, that they can go to the website, thescienceofsleepapnea.com. Tell us about what's coming up next week, Dr. Heit.
Oh, well, next week we're going to have an obstetrician and gynecologist on. So now we're talking about sleep apnea and the impact on a mama and that little baby growing inside. So I'm very, very excited about that. I think vitamin O for oxygen, is number one, and we can optimize the health in obstetrics and gynecology. So I'm super, super excited to introduce you to Dr. Seth Heckman, and we'll be looking forward to that next Thursday here on the live broadcast. And I'm hoping everybody can come on that and ask lots of questions.
I'm looking forward to it too, because it just enriches the conversation. Harmony Myofunctional Therapy says thank you to you both. And I will echo those thoughts. So for those of you watching, and all of us, or all of you rather, that have joined us tonight, thank you for sharing your time with us. Again, if you want to rewatch this broadcast, go to scienceofsleepapnea.com. And of course, mark your calendars, Thursday, October the 28th, with Dr. Seth Heckman, who, as Tammarie mentioned, is an OBGYN. He will be talking about OSA in women and also the impact that pregnancy has on women and sleep and beyond. That will be next Thursday, October the 28th at 5:30 Mountain Standard Time. On behalf of Dr. Heit and myself, thank you so much for joining us live from Caesar's Palace. We appreciate the time you spent with us, and have a great evening, everybody. Bye-bye.
Thanks. Bye-bye.